This COVID-19 update was recorded on November 30th, 2021. As many of you have heard, there's a new variant of COVID-19 called Omicron, and though we are still in the early stages of learning about this variant, it seems like a good time to speak with SVMH's infectious disease expert, Dr. Mahendra Poudel. This is Ask the Experts, a podcast from Salinas Valley Memorial Healthcare System. I'm Scott Webb. Dr. Poudel, it's great to be back on with you. The World Health Organization has designated Omicron as a variant of concern. And of course, we all get concerned when we hear about these new variants. First it was Delta, now Omicron. What else can you tell us about this variant that we haven't heard already? Any mutations? How does it differ from the other variants? What are you hearing?
Just like to put out a disclaimer that these situations are rapidly evolving regarding this Omicron variant, and they're changing by the minute or by the hour. So whatever I say now, it may become irrelevant in the near future. So that being said, the Omicron variant was first detected in the Gauteng province of South Africa, and now it has been detected in many other countries of Europe, Asia, and then also neighboring country of Canada. And a lot of experts believe that it may already be here, and it's just a matter of time that we're going to find out pretty soon. This particular variant is important because it seems to have a lot of mutations, including its spike protein, which is, as you all know, it's the structure of the virus that it uses to get inside the cells, and also it is the basis for the new mRNA vaccines. Based on preliminary data, it seems to affect young and unvaccinated adults in South Africa, but there's a real concern that it can escape vaccine immunity and cause reinfection of previously COVID-recovered patients.
Yeah, that's the concern, right? It's both the unvaccinated, but also for those of us who are vaccinated. And as these variants appear, as the mutations happen, because as we've discussed before, the whole job of these viruses is to infect, right? And, so we're trying to fight those back through the vaccines and the boosters and so on. And it's really this sort of battle royale between viruses trying to do what they do and all of us, including yourself, trying to do what we can do to protect ourselves. And you as an infectious disease specialist, are you worried? Do you think that this Omicron could lead to a massive outbreak and become this huge burden on the hospital system, perhaps even beyond what we've seen so far?
Well, I think it's important to realize what happens when a virus comes out with a new variant or it mutates. It could do a whole lot of things. It could become more virulent, meaning it can cause more serious infection. It can become less virulent. It can become more contagious, or it can become less contagious. So as you pointed out correctly, that the virus is also trying to survive so that it can keep infecting people and live with humanity. And these mutations, they're going to keep happening as long as the virus has the fuel to burn, meaning they're vulnerable, unvaccinated, unprotected population. And as the virus multiplies, that's when these mutations happen. And I think I've mentioned it before that Delta or Omicron or some other variant won't be the last one. And I think we're going to keep seeing those as long as there is constant replication of the virus in the population. So this is definitely a concern, but I don't think there is a big reason to panic. So I would, again, say if you're unvaccinated against COVID, you should get vaccinated. If you have been fully vaccinated, make sure you get your booster and try and protect yourself. Use masks. Try not to gather in big crowds indoors. Is this variant going to become the dominant variant as we go forward? It's really hard to predict, but based on the preliminary evidence we have, this seems to be highly infectious. So, we might see that it overtakes the Delta variant that's predominant right now. So it's really hard to know what the virus is going to do in the future.
Yeah, and I know around the holidays, that's when we all want to get together, right? We want to get together, we want to celebrate, and the longer this wears on, the sentiment seems to be, people just kind of being over it. I'm over it. I hear that a lot. I'm just so over it. Yes, of course, we're all over it, but the reality is, here comes Omicron, here comes another variant, here comes, more reason for concern. So what would be your advice to folks as we head into the holiday season, not only colds and flus and get your flu vaccines and all of that, but what would be your advice about that sentiment of, being over it? There's just every reason for concern, right? We just aren't over it, are we?
No, I don't think we're over yet. I think these variants are a reminder of risks that we face, that we're not safe until the whole world is safe. The virus mutates, you see new variants as it multiplies. So I think there should be a coordinated effort to get as many people vaccinated as we can. And, same thing going into the holiday season. I think for people to protect themselves, protect their loved ones, get vaccinated, be vigilant about gathering and travel, and we got to go by our lives and do the best we can.
Yeah, I think that's such an appropriate word, vigilance. We just all need to be vigilant. We need to hang in there. Hopefully we can fully defeat COVID-19 at some point, but it is starting to feel like this may be something that we live with. Maybe forever. I don't know. I hate to be the bearer of, doom and gloom, but it does feel like we may be wearing masks, even optionally, years from now. We may be getting booster shots every 6 months, every year, just like the flu for COVID-19. Do you have a sense of that? And also wanted to ask you, is SVMH testing yet for Omicron?
So the good news about this Omicron variant is the PCR testing that are available at our institution and throughout the United States, they do detect infection from this virus. To find out if this is the specific variant, they need to be sequenced, which is a labor-intense process. And at our hospital, we do have the capacity to do PCR testing, and we can detect the virus or the infection. But if we need to find out if this is an Omicron variant, then we send our samples to our Monterey County Public Health Lab, and they do have the capacity to detect the variant. And as of today, Delta is still our predominant strain in our county. And going to your first question, is COVID here to stay? It certainly feels like it. As the virus becomes more contagious, we're seeing these new variants. It keeps circulating, finding vulnerable people. So, the hope is as the virus becomes more and more contagious, it's going to infect more and more people, but become less virulent and just become endemic like the flu or the common cold. That seems like what we're heading for, but you can never be certain about this virus.
Yeah, and I'm wondering, as we get close to wrapping up here, for now, we may be back together tomorrow and the next day, but for right now, do we have any sense yet how Omicron affects children?
We don't have much data in terms of how it affects children, but I'd like to add that kids are just getting vaccinated, especially the 5 to 11-year-old. And in our county, about 13% of the eligible kids are being vaccinated. So there is a large number of kids who are unvaccinated. Older kids from 12 to 18, they haven't received their boosters yet. There is less than 5 years kids who don't have the vaccine. So there is this large vulnerable population, not just for Omicron, but also for Delta and other COVID-19 virus. So I think the best thing that parents can do is to make sure they're protected, they're vaccinated, they get their boosters, and be vigilant about who their kids are around.
Yeah, and of course, like my kids, one of my son's in college and my daughter's in middle school, and so the kids are back in school and they're wearing masks. And I've been shocked that really there hasn't been the type of massive outbreak that I thought there would be. And as we wrap up here, and I think, one of the messages we've had all along is that hospitals are safe, right? So don't delay medical care. If you think you're having a stroke, call 911. If you think you're having a heart attack, call 911. Keep your doctor's appointments, but, wear your masks. Be vigilant, as we've said. So as we wrap up here, what would be your final thoughts today, right now? We won't hold you to them because, we understand that this is all fluid. What are your takeaways about Omicron and COVID-19 in general?
Situation is really fluid and things are changing pretty rapidly. So I would say stay tuned and we'll keep you informed of any new development. We're still in the midst of pandemic and we have these awesome tools called vaccines that are very effective, very safe. And at healthcare facilities, we are prepared to take care of you regardless of COVID or not, because although there is the pandemic going on, there are other non-COVID medical issues, including cancer, heart disease, lung disease, that we are prepared to take care of you and closely working in terms of having resources and manpower to take care of those patients. So I would really like everybody to stay safe this holiday season and make sure you are protected and so are your loved ones.
Yeah, that's a perfect way to end. As always, I appreciate your time. And for everybody listening, for more information on Omicron and COVID-19, you can go to our website at svmh.com/coronavirus. So, Dr. Poudel, thanks so much for your time. You stay well.
Thank you.
And be sure to follow us on Facebook, Twitter, Instagram, and LinkedIn. And if you found this podcast to be helpful, please be sure to tell a friend, neighbor, or family member and subscribe, rate, and review this podcast to check out the entire podcast library for additional topics of interest. This is Ask the Experts from Salinas Valley Memorial Healthcare System. I'm Scott Webb. Stay well, and we'll talk again next time.